More children are inflicted with brachial plexus injuries at birth than suffer from Down syndrome or muscular dystrophy or spina bifida. Tragically, most of these birth injuries are preventable.
You would stop every brachial plexus injury if doctors stop pulling heads.
If a baby has a hard time coming out and its shoulders can get caught, a medical provider can overreact and start pulling or twisting the baby's head, attempting to get the baby out. This pulling and excessive traction can damage the delicate nerves in the newborn's neck. These nerves can be stretched, torn, or completely pulled out of the spinal cord. This can result in partial to full paralysis of the shoulder, arm, and/or hand. A brachial plexus birth injury can lead to lifelong disabilities, physical pain, and emotional challenges.
I knew I took great care of myself when I was pregnant. So conscientious about everything that I did, never broke one rule. And for someone else to get his hands on her for 5 minutes and have this happen, it changes your life, it changes your whole journey, it changes the direction that you take.
The brachial plexus injury is when the brachial plexus is damaged, and it is damaged when somebody yanks on the head, and that yanks on the brachial plexus and causes it to be injured. So it is an injury to the baby that is caused by the person who is attending the birth. In medicine, we call it iatrogenic. It means it's a doctor-caused damage, and that's what it is. They call it gentle traction. It's anything but gentle. It is the head should never be tugged on, ever, at any time during the birth, but it is.
When the baby's head is born and it appears to be stuck, one of the worst things you can do is start turning and twisting the baby's head. You can injure the baby and you've not done anything at all about the problem, which is that the shoulders are lodged behind the pelvic bones. So we need to change the mother's position slightly because the baby is not stuck to the mother. If you roll the mother, you actually change the baby's position in relation to her, and the same baby that appeared to be a big problem is going to slide out like a little fish.
For 50 years, they have persisted in putting women on their backs, even though we have known scientifically for at least 25 years that that is the worst of all positions.
It's completely against natural childbirth to keep a patient flat in bed during childbirth. It's the wrong thing to do.
It is convenient for doctors to have a woman lying on her back or in a semi-sitting position. Unfortunately, these positions make birthing more difficult.
If I had a pregnant mom in front of me right now and could tell her some things to try and prevent, I would tell her to become educated about different positions.
By reclining on your back, you're actually closing or narrowing the birth canal by up to 30% because you're putting pressure on the tailbone and not allowing the back and pelvis to naturally expand. You can open your birth canal by simply rolling off your back and onto your side, or by squatting, standing, kneeling, or getting on your hands and knees. To reduce the risk of trauma and injury to your baby, get off your back.
Birth is beautiful. It's nothing to fear. It is one of the most treasured things that we human beings have in life. It is the most amazing thing in the world.